What's up, YouTube? My name is Dr. Daniel Kaplan, and my mission is to make psychology accessible to all. In today's video, we're going to start with cluster C personality disorders. And the first one we're going to talk about is avoidant personality disorder. You're going to be able to identify the hallmark features of the condition, how we diagnose the condition, theories as to how avoidant personality disorder evolves, as well as some treatments. So without further ado, let's talk about avoidant personality disorder. What's interesting about avoidant personality disorder is that it does have some similarities to social phobia, and it is possible for someone to have a diagnosis of social phobia and avoidant personality disorder. The hallmark features of avoidant personality is feeling uncomfortable or inhibited in social situations, feeling overwhelmed with sense of inadequacy or sensitivity to negative evaluation. So people in general might report feeling unappealing or inferior to other people, and they might also have limited friendships. So what are the similarities between the two conditions? The similarity with social phobia is that there is a fear of humiliation and low self-confidence. However, the difference between a social phobia and avoidant personality disorder is social phobias are limited to social circumstances or social situation where there's a sense of judgment, as opposed to avoidant personality disorder, which is much broader, where there's a fear of closeness or developing close relationships. We see that there's roughly 1 to 2% of the population that are diagnosed with avoidant personality disorder, and it's equally common amongst males and females. So the DSM-5 requires 4 of the following symptoms, 4 out of 7. Again, as with all personality disorders, you have to be 18 years older. Older has to be a chronic condition. Has to affect most aspects of one's life. But the specific criteria are that the person might avoid occupational activities that involve interpersonal contact because they might fear being rejected, criticized, or receiving disapproval. There's also distance or restraint in intimate relationships because there's fear of ridicule or judgment. A person develops a sense of preoccupation in terms of social settings. People are not likely to get involved with friendships or other people unless they're certain that they're going to be liked. They might feel inhibited due to a sense of inadequacy. They might feel socially inept, and they're not going to take many personal risks if it could prove to be embarrassing. Now, these are the 7 criteria. As I said, you don't need all 7, you need 4 out of 7. So how do we explain avoidant personality disorder? Because there's some similarity between anxiety conditions and avoidant personality disorder, some of the same risk factors, such as an early trauma or conditioned fears, upsetting beliefs, or biochemical abnormalities, we look for those factors. Now, the direct connection between avoidant personality disorder and anxiety conditions have not fully been linked, but there is overlap. They're separate, distinct conditions, but there is overlap. Now, let's target avoidant personality disorder and some of the interpretations. From a psychodynamic point of view, we're going to say that you develop avoidant personality based on a general sense of shame and how you might have received feedback in your childhood. Cognitive perspective is harsh criticism or rejection. So all of a sudden, people are going to assume that they're always going to be viewed negatively because of their experience. What's interesting is that there is overlap between the psychodynamic and the cognitive perspectives. And there's research for both. And then from a behavioral point of view, it's about social skills. So people develop avoidant personality disorder if they haven't developed appropriate social skills. So what are the treatments? Well, if we're going to think about treatment, first we have to understand what's the goal of the client and what's the primary task of the therapist. The primary goal of the client is to seek acceptance and affection. The primary goal of the therapist is to establish trust so that there can be some more risk taking. But beyond building trust, we're going to treat this condition the same way we would treat a social phobia, whether it be with exposure therapy, whether it be some cognitive restructuring and or some insight oriented therapies. These are some of the treatments. For group therapy, what's cool about group therapy is if you have an individual with avoidant personality disorder, they get to practice social interactions and in a low stakes, low risk environment. And then in terms of medication, anti-anxiety, antidepressant medications are effective. So that is a very quick video on avoidant personality disorder. We did not do a deep dive. It's just a quick primer. If you found the video useful, hit the like button, subscribe, click the notification tab. But more importantly, I would love if you could write in the comment section any questions, reactions, thoughts you might have related to the video so that I can do a deeper dive in the areas that you would like me to. Until next time, take care, everybody.